All right, so good morning, everyone. So today's topic has the title Correlation between Radiographic and Histopathologic Findings associated with unerupted teeth in dogs. And this paper was published recently, so this year in the Journal of Veterinary Dentistry. And we will see what it's all about. So to give you a little introduction to this topic, so we are talking about unerupted teeth, and there are quite some retrospective studies out there looking at what those non-erupted teeth can cause. And we kind of at the moment have at least radiographic evidence that, so this is from a study I will mention later on, that at least in 30% of the unerupted, or the 30% of the unerupted teeth will have clinical significant lesions associated with it. So that's quite a high number. We are not really sure what causes the teeth not to fully erupt. We know that there are some breech predispositions. It's discussed that it has something to do with lack of space and also with a lack of erupting process at all. It can be associated with trauma, but it's not like we are 100% sure what causes the teeth not to erupt. And we can mostly see it with the first premolars in the mandibular jaw. Then if we look at the data, usually those studies are only or mainly looking at radiographic evidence, but most of them don't have histopathologic data for all of the cases. About the authors, so they are both working in a dental referral clinic or a referral practice in North America. So one of the first authors, Dr. Jason Hutt, is the resident of Dr. Mary Karonowski-Folger, and they're both, so they're kind of dental specialists, and that's also the clients they see. And if we look at Dr. Mary Karonowski, she also published a quite known paper about the radiographic signs associated with non-erupted teeth, which we're going to look at now. So if we look at all the previously published studies, so there's, for example, this one, which is also from the same author, but there's also one from an Italian group on frontiers. And what they usually look is at the radiographic signs and what the prevalence of lesions are, and what kind of breeds are predisposed, what kind of age are predisposed. So basically, they're giving us some epidemiological data. But in all of those studies, they didn't include histopathology for all cases. So this is what this study, what we're going to talk about today, is all about, because so they basically have the hypothesis that maybe there is still histologic evidence of pathology, even though we cannot see any radiographic changes. For example, what we can see here on the two images. So one is right lower jaw, where we can see an unerupted first premolar tooth, and we cannot really see any sort of radiographic signs. But maybe we look at this, we can still see for example, what we see on the right image, histopathologic stained tissue from cystic lining. So we can see connective tissue and our non-keratinized squamous epithelium. So this is what this study aims to find out, if there is pathology, even though we cannot see it radiographically. I was already mentioning that there are some retrospective studies out there looking at radiographic signs. I was already mentioning that histopathology usually not included in every case. And what is interestingly, so if we look at the human side, or if we look at the human studies and explorate things from there, we can see that in 33 up to 58% of radiographically normal dental follicles in humans will have histopathologic changes consistent with some sort of pathology. And this is where this study comes in, to see if there's somewhat the same in veterinary patients. If we talk about this study design, so this is prospective study. So they included only dogs, so it's only mentioning dogs, where they had at least one non-erupted tooth. In total, 68 teeth were included. Almost all of them were first mandibular premolars, namely 36. And they were all surgically extracted and they were all sent for histopathology. So the histopathology was the criteria for patients to be included in this study. And if we look at the methodology of this, so in total it was 42 dogs, and I already mentioned it was 68 unerupted teeth. I will mostly, if we come later to the results, I will mostly focus on the 63 first mandibular first premolars, because this is what they also did in the results, because the 5 other teeth, they all, so this was canine, first maxillary incisor and so on, and they all had radiographic signs of pathology. But I was already mentioning quite sometimes that today we will look at those teeth which don't show any signs, and if we can still see any sort of pathology there. So when they had unerupted teeth, they extracted those. And when the tooth showed radiographic evidence of cyst, they raised the flag. They tried to do what is called en bloc recision of bone, cyst tissue, or the tissue they could find there, bone and a portion of the tooth, and sent this to pathology. If they couldn't find any signs of radiographic cystic structure or pathology, they would still open up a flap and basically try to do it in the same way, also resect a bone, tooth, and tissue around. And if there was no bone at all, they would simply submit soft tissue instead of bone, what they could get. So this is somehow how they performed the study. They also gave some. They basically used the same principles they used in the last study for the radiographic signs. If you want, we can discuss it at the end, but this is basically how they surgically extracted those teeth. And what I found out, so first of all, if you remember from one of my first slides, that in their study, 48% of the unerupted mandibular first premolars, so we are only looking at those cases, they had radiographic signs of cyst, which is a bit much higher, so almost 80% higher than the previously studies. But we're going to talk about this in discussion. And only 75% of those had histologic evidence of epithelial lining. Of course, they performed it with all of them, but only 75% had the evidence. Then if we look at the cases where there was no sign of pathology radiographically, most of them, so it was only, so 77 also histologically showed no evidence of epithelial lining, but there were 8 cases, so 22.9%, where we could see histologic changes with the evidence of non-keratinized squamous epithelium or stratified squamous epithelium, even though there were no radiographic signs. So this is 22.9% of the cases without any signs. So you can say that the radiographic findings and the histologic findings were in agreement in 75% of the cases with a cyst, and 77% of cases where no cyst was present. If we look at limitations of this study, so first of all, that's also what they were mentioning, the majority of cases where the owner declined histology were excluded, which means that probably a lot of cases where there was no sign of radiographic change, owners declined to do histology, and that's also one of the reasons why they're saying the number might be a bit, or the percentage of what I've mentioned of dogs with radiographic signs higher in this study, because it's basically it's not, so it's basically a subgroup of patients where the owners were willing to submit histology, and this is what influences our data. Another problem is definitely the sampling technique. It's something they are also mentioning. So on the picture on the right, you can see the region they are dealing with the most. So again, lower jaw, region of first mandibular premolar, and it's a quite narrow space where you have to extract a tooth. You have your canine running there, which you don't want damage. You have your second premolar tooth, and especially in the cases where there were no signs of cyst, you want to be sure to not damage the surrounding structures. So it is kind of difficult to take good sample in this region to not cause more harm than is good for patients. And then basically the biggest problem, if we look at the results of the study, is that even though also, of course, were two board-examined pathologists looking at the sample, but still there are quite some papers out there showing that the epithelium of an early dentigerous cyst and a normal dental follicle is quite similar, and it's hard to differentiate those two. So there's probably a quite, or at least we cannot rule out that there is a number or a false interpreted histological results. But in general, I think what this paper helps us a little bit with is when we are concerned with the question if we should extract a tooth, a non-erupted tooth, without signs of radiographic pathology. So this study more leans us towards the way that we should still extract them, giving the number that there are still some cases where we can at least see histologic changes, even though we cannot be sure that they're all correct. But because this is the thing where we are not really sure in veterinary medicine if we should what we should do with those cases, if we should just recommend monitoring or what we should do. And I think this paper more leads us towards the direction to extract those teeth. And that's already it for this morning, what I have. Then I wish everybody a good day, good morning, and have a great week. See you.